Hey guys, my name is Dr. Wadhawan. I'm an ER physician that is based out of Tennessee. I trained in Detroit, and I'm here to talk a little bit about the type of writing I do at work. First off, in the emergency department, my job encompasses seeing patients of varying acuity levels, so I can go from seeing a patient with an ankle sprain to running to another room where I have to help the team do CPR. And so I work in a busy ER, we see a lot of patients, and we have to be pretty quick and concise when we document what happened just because there's not enough time. Our notes are very standardized in medicine, so every single specialty will kind of structure their note the same way, and we learn this in medical school. The note starts off with a history present illness, so this will be a descriptor of why the patient came in, and so within that we also have to kind of describe what the patient came in for, what kind of pain they're in, where it's located, where it radiates to, if it moves anywhere, if there's anything that makes the pain better or worse, and then any other associated symptoms. So that's kind of in one specific part of the chart. After that, we take objective data. So we'll have listed what the patient's, I'm sorry, there's a bird out here, but what the patient's vital signs are, and what their physical exam looks like. And so the physical exam is very specific to medical jargon. I'll have certain descriptors on how the lung sounds so that other physicians kind of know what the patient looked like when they first came in. After the physical exam and the objective data, we kind of move down to our assessment and plan. So the assessment and plan is taking all of that information and putting it into an actual diagnosis or possible list of diagnoses, and then what we're going to do about it, whether or not this patient's going to go home and follow up with their family doctor or they're being admitted for further workup. Anytime someone gets admitted to the hospital, a lot of times their case is a little bit more complex, and so within that assessment and plan, there's also an area for medical decision making where I kind of go into more detail in regards to why I did what I did for this patient and my reasoning behind everything. These notes are really important because they're reviewed by other people. First off, if somebody does go home, a lot of times the note of what happens in the emergency department goes to their primary care doctor so they can continue the appropriate care in the outpatient setting. So the same thing happens with a patient who gets admitted to the hospital. Again, that chart is reviewed by my colleagues who are the hospitalists or the specialists within the hospital, so they can see what the patient came in for, what they looked like, and why I did what I did, so they can continue what the appropriate plan is for the patient. Lastly, these notes are reviewed by our billers, and so in order to get billed for what I do for work, my chart has to meet a certain level of proficiency. So I have to have all of these things, the history present illness, the physical exam, certain aspects of the physical exam for somebody who's a more complex patient. I need to make sure I describe more body parts of the patient so I can get paid for that. So this is important to have the appropriate documentation so I can get billed for what I do. And then lastly, these notes can sometimes be used in a court of law. Litigation cases where, unfortunately, I could be getting sued, or the hospital could be getting sued based off of a workup or a patient. I need to make sure that I have everything documented appropriately to protect myself. In the court of law also, patients can be involved in gang violence or sex trafficking or abuse cases, and so these notes are also used for good as well, I guess. If somebody needs to be prosecuted for harming another person, I have documentation to show what exactly happened to the patient. So most of my writing really is just centrally kind of revolving around my documentation for the charts for the patient, and that's kind of it. So if you have any other questions or interested in medicine, feel free to contact me. Thanks.